So I just got off the phone with a prednisone warrior who was wondering if he could use his stockpile of prednisone to treat a certain kind of pain. Find out what I told him in this live video. So this guy, I'm going to call him Terry. He took prednisone a long time ago and his doctor only gave him a week's worth. And he was wondering, hey, they only gave me a week's worth and I felt great when I took it. While I'm here in Mexico, I think I'll stock up and get a whole bunch so that I can feel really good the next time I'm not feeling that well. And so he did. He got a whole bunch of boxes in Mexico, and then he just barely had surgery on his feet. And his legs are on fire. They're really hurting. And he's got a kind of like nerve pain. And he's wondering, can I take prednisone for that? And if so, how much? And are there any reasons I shouldn't take it? And so here are my answers. First of all, prednisone doesn't really help as much with nerve pain. The kind of pain he was referring to is like he had surgery and they cut the nerves and now it's really hurting from the surgery. This isn't an opioid. Prednisone is not that kind of a pain medicine. And that's my little baby. Yes. And so prednisone doesn't help with that kind of pain. So you wouldn't want to use it for that kind of a pain. Second, how much would you use? Well, I wouldn't use it for that kind of pain. Third is, why shouldn't he use it, right? What would be the reasons he shouldn't use it? And this is what I told him. I said that I hear from people at least once a week, if not more often than that, about what they wish they had known. That they wish somebody had told them how terrible the side effects would be. And if they had known how terrible the side effects would be, they wouldn't have taken it. Yes. And so he said, like, what side effects? And I said, well, how about disabling anxiety when you've never had any anxiety in your whole life, or terrible depression, or terrible mania, psychosis, all of these horrible mental health issues. And that's just the mental health ones. What about osteoporosis, having bone breaks, losing several inches in height? What about eye problems, suddenly not being able to see anymore from glaucoma, or like the list just goes on and on. There's 150 side effects, right, guys? And so I said, taking prednisone is not something I would do lightly. It is like making a deal with the devil. When you take prednisone, you are getting something wonderful in return for 10 horrible things. And so it could be worth it if that wonderful thing is what's keeping you from functioning. Like for me, I was going to bleed to death if I didn't take prednisone. Other people, if they don't take prednisone, they're stuck in bed. Like they're bedridden. They can't use the bathroom on their own. They can't do anything on their own. And so taking prednisone is worth it to them. But for a lot of people, it's a good question. Is it really worth it for you? And that's a conversation you definitely need to have with your doctor. You need to understand 100% how beneficial prednisone will really be for you before you can decide whether all of those side effects are worth it. And in his case, I can pretty much guarantee it's not worth it because number one, his doctor didn't prescribe it. Number two, prednisone isn't used for that kind of pain. And number three, he's just going willy-nilly. He doesn't know what the benefits are, and he doesn't know what the risks are. And so you need to find out what, in your specific situation, the benefits are. The risks are unpredictable, but I mentioned a whole bunch of them. If you want to know more of the risks, check out my website, prednisonepharmacist.com. and get the checklist so that you can know how to prevent the top 7 mistakes that people often make on prednisone. Signing off is Dr. Megan, your prednisone pharmacist.